Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, I'm glad to have you here again. We're going to talk about our favorite two words, sharing and caring. And the reason we need to share is because we need to share what our med moments are. Those episodes in life that lets us know that we must see our doctor. That chest pain, that knee pain, that shortness of breath. You need to see your doctor. Those are med moments. We need to share them. So email me at www.medmoments.com, or you can tweet me at medmoments. Well, I'm going to give you a challenge out there. Everyone a challenge. Just because you can. Why don't you, if you have a senior that lives next door and they need to go to the supermarket, why don't you take them to the supermarket? Or if there's some children down the street that don't get a chance to go to the park, take them to the park. Do something nice for somebody. Just because you can. All right, we're going to start with what we're going to talk about. Our main topic tonight on the show is going to be deep venous thrombosis, or blood clots. And this is a very important topic. I have the perfect person to talk about this particular topic. Her name is Dr. Alice Cohen, and she is the Director of Hematology Oncology at Newark Beth Israel Medical Center. Let me let you know. Hematology is the study of blood, and oncology is the study of cancer. And this is what she does. She's the perfect person to take us through this subject. Dr. Cohen, welcome to our show.
Thank you for having me.
Oh, yes. Well, this is your second time on the show.
It is.
Yeah, and I'm so proud that you could come and deliver this topic again for us, okay? Oh, the first time, this time, yes. Well, I'm going to ask my usual question, and it's a basic question, but it's one that I think that needs to be asked. What is deep venous thrombosis, or DVT?
Deep venous thrombosis means a blood clot in a vein.
Right.
And so what does that mean? It means that the flow of blood through a vein is being obstructed or blocked because that blood has thickened and blocked the flow. Vein is a particular type of blood vessel, and we have two blood vessels that carry blood back and forth through our body. One is the vein, which is returning blood to the heart and actually flows more slowly and is a good site for blood clots to form.
Oh, okay, all right. So you're saying that because the blood is flowing slowly, it has more tendency to clot?
Absolutely.
Oh, okay.
And examples of that actually are individuals who tend to have a higher risk of getting blood clots. For instance, if you're hospitalized in a bed after surgery, you're not able to walk and move around. Right. One of the reasons you have an increased risk of blood clot and can get a blood clot is because you're moving and the flow of blood is even slower.
Right. So, so I think one time a professor had said something about one of his the people that are prone to blood clots are people that may be sitting and their blood flow is not coming around their knees or something like that. If somebody's taking a long flight, or if someone's taking a long car ride to get up and walk around, is that
Correct.
something that people need to do?
These are risk factors for blood clots. Usually patients have something else, but not only. We see many patients referred to our office who have gotten a blood clot after a long plane flight. That is a very common. And actually, right now, if you go on the airplanes, most of the airplanes have protective suggestions as you get on that plane to try and reduce the risk.
Oh, all right.
Also, even sometimes just sitting with your legs crossed, cramping the flow can increase the risk of blood clots. So we see individuals who are now working at their desk all day on their computer, and they don't get up and move at all, leave their legs crossed, and they are at increased risk for blood clots.
Blood clots as well, All righty. Now, let's go back to veins and arteries, because there are big differences in the two. A vein, you said the blood flows slowly through a vein, but an artery, it flows faster?
That's correct. So the arteries are the blood vessels that carry the blood away from the heart. And they're carrying oxygen and trying to get to the vital organs, your kidneys, your liver, your brain. And so the blood is pumping much faster and actually has a lower risk of getting a clot just through flow problems.
Okay.
The veins return the blood to the heart. They've already delivered the oxygen and they're taking their time to do that. And so they're at higher risk for blood clots. We do see blood clots in arteries, but it's usually because there's some other problem that triggers that blood clot in an artery. So example, an artery blood clot might be a heart attack. And that's because patients have high cholesterol and fat clogging up the artery and then the blood vessels narrower, and so they clot.
Okay.
That's different than the vein.
Oh, all right then. What about as far as age is concerned? Do very young patients get clots, or is it more prone in older folks getting clots?
It's much more common to be older and have a blood clot. So higher risk as you get older. Rarely we see babies with blood clots, but that's usually because they have some other medical condition that might precipitate it or have an inherited risk factor for that. In general, we're talking about more common in people over the age of 50.
Okay. So is that because they have old blood and the babies have, that young blood?
It's a really good question, and I'm always trying to figure that, is the blood getting older? But I do think that the blood vessels do get older.
Okay.
And so we have linings of the blood vessels that protect us from blood clots, and those blood vessels linings get abnormal as you get older.
As we get older. All righty. What about race? Is there any particular race that would get blood clots more than another race, just because that particular, you find that in the research, anything like that?
Right. So in general, we would say all races are at risk for blood clots. There are certain inherited predispositions that are more common in people from Western European descent, but most of those also are transmitted from generation to generation, and there's no reason that any particular race is really at risk. Certain medical conditions increase the risk, and if we see those medical conditions in a particular race, it's not really genetic based, but could be there. So more medical conditions and inherited predisposition than actual race.
Okay. What about gender? Female, male?
Equal across the board, though sometimes we see women have increased risk of blood clots because of certain, again, conditions, like pregnancy. Men can't get pregnant, but pregnancy is a very high risk time for blood clots. That's because estrogens that get high with pregnancy increase the risk of clotting. Women who take birth control pills at increased risk of clotting. Older women who take estrogen hormone replacement, increased risk of clotting.
Oh, goodness. What about, I know with some of the young kids and playing sports, and I know my son played football, and he would often come home with a big knot on his thigh or something like that from hitting the helmet, hitting his leg. Does that increase the chance?
And that's a very interesting question. When you see those kind of clots in the skin, that is a different kind of clot. That's after a bleed, and then there's clot, and it doesn't predispose to the blood clot in the vein. However, if you have a very large bleed in the muscle, or you've been injured at that site, the blood vessel underneath could be injured as well and then get a clot. So we have seen some of these soccer players get injured, and then their leg is swollen and painful, and then later on they get a clot there.
Oh, all right then. Now let's talk about things like risk factors. What would make me more prone to be to develop a clot? You had talked about birth control pills, but there are other things, like what about cancer and things like that? Does that increase the chance of blood clots in your system?
The most common reasons for blood clots are not inherited reasons, but secondary to another medical condition. The biggest risk factor is cancer, particularly those who have had surgery for their cancer and those who receive chemotherapy for their cancer. But sometimes hormone treatments for breast cancer, for instance, will increase the risk of blood clots. It's been felt that about 50% of patients who have cancer will have a blood clot at some point during their treatment phase or condition. Other causes, diabetes, high blood pressure, having heart disease, and obesity is a big risk factor for blood clots.
Oh, goodness. Well, obesity, I wouldn't have thought obesity, but just being overweight.
Correct.
increases your chance. Is
Correct.
that because because you're larger, the flow it slows down even more?
Yes, and you may be less mobile because you're also, again, slowing the flow. Many people with obesity also have secondary diabetes and high cholesterol, which will, again, increase the risk.
Increase the chance, yeah. In your office, if someone's going to present with a blood clot, how do they usually present? What makes your antenna go up when a person comes in?
Right. So the most common site for a blood clot is in the leg.
Okay.
And that can be anywhere from your hip all the way down to your toe.
Okay.
The most common then presentation of that is to complain of pain in the leg or swelling in the leg or both. And oftentimes we don't have an exact risk factor that we identify. So sometimes they get off a plane and a few days later they complain of that swollen leg. But sometimes we've heard patients just wake up in the morning and they notice that there's pain in their leg. That pain can be cramping in nature, aching in nature, burning in nature. There are all sorts of pain feelings, but they usually are persistent. So it's not come and go, but a continuous pain.
Okay, all right.
And also, if it's usually on one side as opposed to both sides, that's more likely to be a sign of a blood clot.
Okay. Is blood clots usually in the lower part of your leg or the upper part, and can it be even in your abdominal region, in your tummy area?
Yep, it could be anywhere. More commonly, it starts initially in the calf area, but then it can extend further up. And so it's the extension of the clot that we really are concerned about and would like to identify it early when it's just below the knee, but it's not always possible.
All right, let me clarify that, because I've always thought that a clot is a little ball, like a little clot. But you're saying that it really can extend and be very long and fill the vessel up, you mean?
That's correct.
Oh.
So the blood clot is really the formation of blood filled with something we call fibrin. It's like almost straw in there that's holding the blood clot together. And it starts, you're right, just as a tiny little clot. Proteins come in, it forms this clot. But then, as the blood cannot flow through there easily, more clot can form on top of that, because our blood is filled with these clotting factors, and it just is like a building block. It just keeps stacking on top, and it just keeps extending above. It usually doesn't go below, but actually goes above.
It goes above as well. Wow. What about as far as now? Being a pulmonologist, of course, cigarettes are my baby. I always talk about patients to quit smoking. Are cigarettes a problem as far as clotting is concerned? Because I know they have so many other problems as far as the blood vessels. Do they increase the chance of clotting as well?
They do, and they actually are even worse for those rare clots in the arteries. They can cause the blood flow, the artery to kind of narrow down and spasm and increase the risk of clotting within the arteries. But they're also a risk factor for venous thrombosis as well.
Okay, all right then. Can this be fatal? Can you actually die of blood clots?
Yes.
You can.
And you can't die of the blood clot in your leg. You can have a lot of pain and symptoms, but remember how we talked about building up and that clot extending up? Well, the next thing that can happen with the clot sitting there is the blood is really trying to flow back to the lungs and to get more oxygen again. And pieces of that blood clot can break off. And then they continue to flow back to the lung, and they get trapped in the blood vessels in the lung, and that's something called a pulmonary embolus. That can be life-threatening. So we're not worried so much about the clot in the leg. It's not going to harm us. It can be painful, but it's that breaking off and extension that can lead to blood clots in the lung. That's life-threatening.
Oh, goodness gracious. Now that you've seen the patient in your office, you kind of see the swelling in the legs and the pain. How do you diagnose it? How do you confirm that this is really happening to this patient?
If we're suspicious that the patient has a blood clot, we want to act right away, because that can be an emergency. Again, we don't know if a little piece has already broken off. We don't know how long the patient's had the clot. And if a piece is going to break off, we don't know when it's going to happen. So we want to make the diagnosis right away to get someone on treatment to prevent that blood clot from moving from the lung. So what we want to do is actually bounce sound waves off that leg We use a microphone. We send the patients to a vascular laboratory,
Okay.
and they put a microphone on the leg, and they can look at the flow and see if there's a blockage in the blood vessel and tell us that there's a blood clot there.
Okay, and that's how you diagnose it. Then you know it's there and you know you need to start treatment right away.
That's correct.
Okay.
We will get an answer immediately from that laboratory
Right.
by telephone or by fax.
Right.
And usually when we send the patient to the laboratory will either hold them or send them right back to us for the results so we can start them on treatment, which needs to start that moment.
Okay, all right. So describe again what the clots are made of. You know, the blood has liquid in it. It has all kinds of blood cells and stuff like that. Is it because the cells are abnormal, or what makes it
Right.
clot other than the fact that it slows up? You know.
So our blood is made up of cellular components. They're the red blood cells. There are white blood cells that fight infections. The red blood cells carry oxygen, and platelets that help blood clotting. They start the clotting mechanism. But the rest of our blood, which you're right, is fluid, and within that fluid there are proteins that are clotting proteins that become activated, and they form this mesh, which actually is almost like a jelly. It's like if you make Jell-O, right? You
Right.
pour the water in and it's liquidy, and then you let it set and it becomes Jell-O, and
Right.
it's set. That's what's happening to the blood. Suddenly, in that area, these proteins activate and they form Jell-O within the blood vessel.
Okay, so proteins are like little pieces of whatever that are floating in the blood.
Right. So they're microscopic. We can't see them
we
under
can't
the
see them.
microscope.
Okay.
But we can
Well, you
measure
can-
them in test tubes
Okay.
as their function.
Okay.
And so if you go to your doctor's office and they draw blood into a little tube,
Right.
certain of those tubes, you'll see the blood clot suddenly. It'll be liquid, and then suddenly it'll be this thick red stuff. So it's
So
red
it happens
because
that
they're-
fast?
Yeah, that fast.
Oh,
Within
my goodness.
usually 120 seconds, we can get it to clot.
Oh, all
and
right.
within that, it's red because there are red blood cells within that. So you do have cells in there, but this mesh forms around them.
So when you cut yourself and a scab or a clot forms, is it very similar? The same thing happening?
Similar. And when I talk to my patients about why doesn't your whole arm clot off after you cut yourself, or the
Right.
doctor puts a needle in there, it would, except on the opposite side, we have some protective proteins that stop the blood clotting.
Okay.
And it seems to know clot where we put the needle in, but stop clotting so the whole blood vessel doesn't clot off every time you bang yourself or they put a needle in.
Right. So smart
Okay.
blood.
Smart blood. And so sometimes we've tipped the balance. If someone gets a blood clot in their leg, that smart protective proteins can't overcome the activation of these clotting proteins.
Okay.
And it could be because of flow problems or another medical problem or an inherited problem where those protective proteins don't work.
Oh, all right then. Okay. When you get clots, I know it can go up to the lung, but can it affect other organs as well? I know the lung is a major issue as far as clots flicking off and going up. But what about other organs in the body?
Right.
Does it affect those
So
as well?
rarely it can, and it can be, again, very serious. So we've seen patients develop blood clots in their kidney. And if that happens and we don't find it quick enough, we can lose the function of our kidney.
Oh, goodness.
We've seen blood clots in the blood vessels around the liver, and that can cause liver dysfunction and swelling like you have cirrhosis of the liver. And in the arteries, of course, we can see blood clots that lead to heart attacks and stroke. So these are other areas where we have to be concerned about, and we have to monitor the patient throughout the treatment.
Okay. Now, I just want to get a better understanding of this heart attack and stroke thing, because this is fascinating. You mean you can actually get a clot in one of the chambers of the heart that would block the flow of blood or something like that?
Yes, you can have a few things happen in the heart.
Wow.
Within the chambers of the heart themselves, that's filled with blood. And normally, the heart is pumping just fine, but there are individuals who have rhythm problems of the heart. The most common one is something called atrial fibrillation, or
Okay.
AF. They're advertising them on TV all the time now.
Right.
And when the heart doesn't pump regularly, the blood can pool like it did in your leg, and it can form clot there again. So that then, if the heart rhythm goes back to normal or is erratic, that piece can again be pushed out, and it can go to the brain and cause a stroke.
So a stroke is actually a blood vessel getting clogged, the artery getting clogged, so there's no more blood going to that part of the brain.
That's correct.
Wow. Wow. So this all can happen just because the blood is clotting too fast.
That's correct.
Interesting.
There are other reasons like atherosclerosis again, but ultimately in that blood vessel,
that went over my head.
so if your blood vessel is filled with fat, and it gets clogged up from your high cholesterol, then the blood will clot on that and also cause a stroke or a heart attack. So it is all about clotting, though, and those are all the preventions we use for heart attack, stroke, and venous thromboembolism.
Interesting, interesting. Can this clot, do the clots always go away, or can it become chronic, meaning that it's always a problem, there's always a bit of clot in that vessel?
So once we find that someone's had a venous thromboembolism, our first thing to do is to act quickly and put patients on a blood thinner, something that makes the blood flow more easily and stops actually those proteins we were talking about that's building the mesh, stop them from working. So we're stopping the individual from clotting. We're doing that all over their whole body, usually with a medicine they either take as a pill or as a shot or as an intravenous through an IV in a hospital. And once we slow that down, the body has its own little chewer-uppers that's going to eat away at that clot and open up the blood vessel. However, for many individuals, that blood vessel may never be the same. They may wind up with some chronic clot and some swelling of the leg.
Interesting. So if there's a chronic clot and the blood is not going past appropriately, is there a reflection on the skin? Is it like, does it change? And sometimes you can get different things that'll increase pigment in the skin, or chronic swelling, or even ulcers and stuff like that. Does that develop in these type of patients?
Yes, it can. And so when the blood vessel is clotted, the body's pretty smart, and it tries to create alternate routes. When there's a car accident, you're going to go around the other way. So they're tiny little blood vessels that sometimes take over. Even when the clot opens up, those little tiny blood vessels might have gotten bigger and they stay swollen. So often when you stand up and walk around all day long after having had a blood clot, you see swelling. So the blood can swell, and the blood flow is not totally normal. So some people see those changes. The skin gets lighter or darker. You can see little small ulcers or breakdown in the skin that can happen. Fortunately, not for most individuals, but about 15-20% of the time that can happen.
What about as far as treatment now? I know that you had mentioned something about a blood thinner, the medicine that would thin the blood. Do you have to be on those for the rest of your life because you're afraid it's going to happen again?
It's a great question. So blood thinners are used for usually at least 3 to 6 months after your first event. And after that, we evaluate what caused the event. If there was something that we know was the trigger, and we can get rid of that trigger, then we don't have to keep you on a blood thinner again. So for example, if it was just a plane flight, we're not going to keep you forever on it, but we might protect you when you go on your next plane flight. Again, if it happened after surgery, and you're now walking around and well, after your 3 or 6 months, you can come off the blood thinner. On the other hand, if you have a medical condition that is still there, then you might need to stay on it longer.
What if you had a blood clot in the past? Are you likely to have one in the future, more likely for it to reoccur?
Again, depending on what was the initial cause, yes, you might have. And again, sometimes those individuals who had a very large blood clot in the leg and are left with that big swollen leg have a higher risk of having it happen again. And we want to try and figure out who those people are, because those are the individuals we're going to stay longer, maybe not forever, but at least longer on the blood thinner to reduce the chance of it happening again.
Okay, all right. So let's review this for a second. A blood clot is, all of these elements in the blood coming together and forming this jelly stuff that just clogs up the vessel.
Correct.
All righty. And once this happens, then we try to diagnose it. And
Correct.
I employ all, if you have any pain or any tenderness or swelling in your lower extremities, or in your legs, I should say, lower extremities, then go see your doctor. And this is what they should do at this particular point.
Absolutely.
Yeah, this is such an important topic. I had a sister-in-law that had a blood clot, and it was very traumatic for my family for her to have it. And she was very young when she had it, actually. So this is something that can be very devastating to the patient as well as the family.
Absolutely, absolutely. And actually there are networks and websites for individuals who've had a clot to actually be support for them with not only the information about identifying it, but what they can do to protect themselves and support other family members who might have had a family member who've had a blood clot.
Okay, all righty. Well, thank you very much for coming and covering this topic. As usual, you did a great job. Thank you very much.
Thank you for having me.
All righty, and that's Dr. Cohen. Well, in closing, let me tell you, sharing and caring. And I challenge everyone out there, do something special for somebody just because you can. All righty. Remember, www.medmoments.com. Email me, and @medmoments, tweet me. Okay, never institute any change in your medical care until you consult your physician. I trust each and every one of you continue good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all. All right. Thank you very much, Alice. Go.